that our receptionist gets when I do the press conferences in the afternoon. Please stop doing this.
Right?
You're interrupting my
My life.
bold and the beautiful or something.
That's about it. Mark, you talk for a second, just like get a level on
1, 2, 3, 4, 5. Mondo Twakat. Disinfectants, Cheery. We need our sign language individual, Kendra. I'm not certain where she is. If she actually had to leave or not.
Mark, while we're waiting, could you give us the names and spellings of all your guests?
Sure. Well, why don't I allow them and they can give you your titles. So why don't you start out with Lynn?
Hi, I'm Lynn Fusco, Lynn, F as in Frank, US as in Sam, CO, and I'm the district superintendent for Erie 1 BOCES.
Dennis? Just name, spelling of your name and your title.
You hear him okay?
Hey, Dennis Quo, D-E-N-N-I-S,
Make sure,
K-U-O. I'm medical director at Buffalo Public Schools.
David?
David O'Rourke,
are we on channel 4?
O''R''O''R''K''E.
Yeah.
I'm the district superintendent of Erie 2 BOCES.
Could you spell your last name?
O''R''O''R''K''E.
Yeah.
Thank you. And your title was?
District superintendent
Right,
at Erie
yeah.
2 BOCES.
15th floor.
And Michael Cornell, MICHAEL, Superintendent Schools, Hamburg Central School District, President of the Erie Niagara School Superintendents Association.
We should be starting shortly. I don't need to call till we're starting.
Thank you.
Tell her, yeah, we got the interpreter girl, we gotta wait on too. Okay, all right, great.
Some cameramen. Some of them are trying to come in the building and get into this room.
Would that be fire alarm
That would be
related?
unfortunate
It would be
for
unfortunate.
them.
Well, yeah, because it would not be a good ending to their day. Let's put it that way. But so
George, Mike, Aaron.
Dave,
Charles.
yeah, Dave was down there. Tom Dinky. Welcome back.
Good to see you.
Mark, are you planning to have a regular press conference tomorrow too, or no?
We're still working on it. Usually we release the data on Tuesdays anyway, but if not tomorrow, Wednesday. Don't lock it, don't close it, because it'll lock from the outside. Thanks, Kendra. No, we got all our daily steps in going down the stairs.
So you guys not jogging up the stairs, Mark?
No.
No.
Actually, pre-COVID, I used to try to walk up the stairs from the basement where I park to the 16th floor at least once a day. That kind of ended with COVID. And as a result, the pounds have come back on. But yeah, at least once I'd go down to the first floor or the 16th floor and just walk up the stairs. And then I'd go in my office and cry. It was not a fire drill, for the record.
So if someone illegally pulls the fire alarm and there's no drill, how do you catch that person?
We have video.
Good.
I don't think it was illegally pulled, though.
Oh,
The information I've received is it happened on the 15th floor when they were doing work in the server room. So, it doesn't sound like it was illegally pulled. But we're confirming that all, and we could go exact moment to look and check it through video, because this building has videos every floor on both sides, not everywhere. But we do have that capability where the alarms are.
What's it believed to be?
They were doing work in the server room. And the 15th floor is our IT department. That's where the major servers are, Blade networks and all. So there was work that was being done up there. Don't know what happened.
Not the yellow wire instead of the red one.
It's an episode of MacGyver.
Yeah. Toothpick and bubbles on campus.
Hey.
We're back, I'm back on the,
Do we have everybody, Dan, that we're aware of?
I think it's all kids now.
That's, yeah, I can't beat the Price is Right. Let's just wait for everyone to get situated, and then I'll do a brief intro and welcome back up our next guests. Cameraman, you need this?
Yes. Thank you, Mark. That's great. Awesome, thank you.
You good over here? Charles, you good?
We'll be starting 60 seconds, everyone's okay with that? 1 minute warning.
Should have had like the old movies, just intermission.
You're gonna ensure the beer was sold.
Yeah.
Okay, 30 seconds, folks. Don't wait on Chuck, you can just say okay when you're ready to go here.
all set? Okay. Welcome back to phase 2 of our briefing in regards to the school guidance. As you all know, probably, we were interrupted due to a fire alarm that went off in the Rath building. I have received information that indicates that the alarm went off on the 15th floor in the server room area of the Department of Information and Technology for Erie County, the Department of Information and Support Services, it's officially known as. We're looking into exactly why it went off, whether it was alarm went off on the 15th floor in the server room area of the Department of Information and Technology for Erie County, the Department of Information and Support Services, it's officially known as. We're looking into exactly why it went off, whether it was something associated with the building, the room, or others that were working on it, and we'll have that information eventual. But I do want to thank everyone for rejoining us as we go through the issues associated with our school guidance, which of course is why we're here. And we were in a position at the time of the fire alarm where we had just heard from Dennis Quo, the Chief Medical Officer for the Buffalo Public Schools, on why this guidance is important. I am also going to allow our other guests that are here, who are still here, and thank them for giving their comments with regards to the guidance that we've issued today. Once again, the guidance can be found online. Let me go back. Oops, I must have passed it. There was a link here, wasn't there?
Go back one. That's it.
Oh, okay. I was looking at the pictures. So you can see and read the full guidance online, as well as a summary document at erie.gov/COVID-19/schools. One thing I want to note that you can also find online is a letter received from more than 70 area pediatricians who asked us to require masks to be worn in all in-school settings for this school year. So I want to thank the local chapter of the American Academy of Pediatrics for their support of our guidance and also for their comments in regards to the importance of mask wearing in an in-school setting so that all children be given an opportunity to learn in school and to avoid the virtual issues we had dealt with last year. So with that, I'd like to introduce to this podium right now the District Superintendent of the Erie 1 BOCES District, Lynn Fusco, who's also been a direct conduit to the superintendents of all the schools through Erie 1 BOCES. So Superintendent Fusco.
Thank you very much, and good morning, everyone. I would like to thank County Executive Polenkars and Commissioner Burstein for partnering with all of the superintendents in Erie 1 and Erie 2 to design the guidance for us to open schools safely for all children. Their courage and leadership in stepping into the void that was left by the New York State Department of Health in terms of guidance for schools opening safely is much appreciated by all. We have one goal and one goal only, and that's to maintain a safe environment for all school children and school personnel during this 2022-23 school year. And with that, I just want to say thank you once again and look forward to continuing the conversation and the partnership that we've had throughout these past several weeks in order to put this guidance together. So thanks so much to the both of you for all of the work that you've done and your school team, who is absolutely wonderful. Thank you again.
Thank you, Superintendent Fusco. And this is not the first time that we've talked since the beginning of COVID. The individuals that you'll see here from the schools have had a lot of conversations with us, whether it's WebExes or phone calls, as we try to do what's in the best interest of our students, faculty, and staff associated with schools, always omnipresent to protect everyone from COVID-19, which, as we know, is still out there in our community and country. One of the other individuals had an opportunity to deal with a lot during the past year. was the superintendent of the Erie 2 BOCES system, David O'Rourke, who also represents not just Erie County through that district, but also Cattaraugus and Chautauqua County as well, even though this guidance only applies to Erie County schools. Superintendent O'Rourke.
Thank you, Mark. When the New York State Education Department and the New York State Health Department, when the New York State Health Department did not issue guidance, declined to issue guidance to schools, I think schools in the region were stunned. We really felt that it was appropriate that we work with government officials in determining what the best way for schools to operate is. And so we're very grateful to Mark, to Gail, and to the Erie County Health Department staff who have worked very hard, and really on two levels. One is we know there are a lot of perspectives to gather together to create guidance and to represent the best practices that we know of in terms of medical authority. And we're impressed with the way in which Gail interacted with schools and brought schools together to attain feedback and guidance on school operations as they put together this guidance. And the second, I think, is to take the step of providing leadership to bring people to common best practices throughout the region. So I'd echo my colleague Lynn Fusco's comments earlier, and we're grateful to the county for the partnership. Partnerships aren't always easy. There's lots of cultures to figure out and practices to understand from each other's operations, but we know that I think at the end we have a guidance document that's going to help all kids stay in school 5 days a week as best we possibly can, and also stay safe along with their staff. So thank you.
Thank you, Superintendent O'Rourke. Someone I've had the pleasure to talk to a lot in the last year is Superintendent Mike Cornell from the Hamburg School District, who also is the president of the Erie Niagara Superintendents Association. Mike and I have talked a lot about school issues as it pertains to everything you can imagine, from sports to just getting them back into school safely. And I thank Mike for his leadership on this issue. And working together, we've got a school guidance that we believe will get every student back into school 5 days a week safely. So, Mike?
Thanks, Mark. So I want to take a minute and broaden the frame a little bit. Our school-age kids have not been in school for a full 180-day school year since the 2018-19 school year. Our kids have been in school for like 7 out of the last 70 weeks. So for school superintendents, for boards of education, for everybody here, there's nothing more important than doing all we can to ensure a full year of safe in-person learning for every child this year in 2021, 2022. It really is a community. I mean, we're here together because we've taken kind of an all-in approach to making sure that we have all of our kids in school, in person for 180 days this year. And what that means is that we do it in schools that operate as normally as possible, right? That means meals in cafeterias, physical education classes in the gym, music classes allow for singing and playing of instruments, and sports and activities that our kids can enjoy. And our kids lost a lot of that last year. So we're committed to making sure that they don't have to lose out on that stuff this year. The Erie County Department of Health has developed a guidance document in collaboration with superintendents that sets forth recommendations and requirements for school districts in Erie County. And we readily acknowledge the authority the county has to issue the guidance under the state of emergency that exists in the county. Given the uncertainty of what we'll face over the course of the next several weeks, we believe this guidance represents the surest path to safely opening our schools in September and to staying open to in-person learning for all students every day while we ride out the last wave, or at least this wave of the pandemic. As we've said since the beginning, our role as public educators is to take care of the learning, social, emotional, and nutritional needs of students while they're in our care. It's the role of public health agencies to establish public policy regarding the health-related operational items associated with operating schools in the COVID era. New York State Department of Health declined to do that. The Erie County Department of Health has done exactly that today. Importantly, we appreciate the provision that for the guidance that we'll review it periodically, according to the data, and as well as to accommodate updates from federal agencies and state agencies. No plan is ever perfect, no plan is ever done. And I think that's important to keep in mind. So while this is how we'll have to start the year, I don't think anybody expects that this is how we're going to have to end the year. We also understand that there may be some disagreement about some aspects of this guidance. but there can be no disagreement about the fact that maintaining in-person learning 5 days a week for 180 days for all children is absolutely essential. When children learn in person every day, schools can much more effectively serve their learning, social, emotional, mental health, and nutritional needs. And nothing is more important to school superintendents and school boards than that. And just a word of thanks before I close too to all the school staff across Western New York who will start getting back into school next week and who will do the same amazing work that they all do to serve the many needs of our children. We're grateful for the amazing people. We're not just school districts, we're not just buildings, we're people. And we have amazing people, some of the best people working in Western New York work in our community schools. So thanks for what they'll do this year to help keep our kids safe and keep them learning every day. So thanks to the Erie County Department of Health and the County Executive for their collaboration. We're grateful for it, and it's something that you can count on us. We'll keep it going and make sure we keep our kids safe and make sure that we address the various aspects of the plans as the data changes and as guidance changes from the state and from the federal government. So thanks.
Thank you, Mike. As we noted, this guidance is in effect for all public, private, charter schools in Erie County, effective immediately. There are some schools in which there are students that are returning for sports and practices before the school year begins, so it does become effective immediately. The guidance, of course, for those who want to review it is online at erie.gov/COVID-19/schools. We'll open it up to questions to the media. From the media, I should say, I just ask that you identify yourself and who you're from so our guests know exactly who's asking questions in case one of those questions needs to be directed to our guests as well. So any questions? Mike?
Mike Baggerman from WGRZ-TV. I wanted to ask you just about the policy of kids greater than or equal to the age of 2 having to wear masks in school. When this came out over the summer for day camps, child care settings, it was very heavily criticized for the ages that were involved, 2 and older. Is there any consideration to changing it for kids 7 or older, 8 and older, instead of 2 and older?
I will turn it over to Dr. Burstein to answer it in greater detail, but I know this is based on the information that we've seen with regards to childcare, pre-K, and as well, children under the age of 12 cannot be vaccinated. Though, while everything was going on, we did have some good news. The FDA approved Pfizer for permanent use, not emergency use, for those 16 and older. So that's a good step that I think a lot of us have been waiting for, and some people said they weren't going to get vaccinated until the permanent status was offered, and it has been offered at least for 16 and older. But I'll turn the rest of the question over to Dr. Burstein to answer with regards to the 2 and above age range.
Thank you. Well, the reason we are mandating mask wearing for people who are physically able to do that for ages 2 and above is for the following reasons. 1, this is consistent with AAP and CDC. 2, we know that children can transmit and get infected with COVID-19 even if they're asymptomatic. And remember, we are trying to prevent COVID-19 transmission in the schools to make sure that we can keep as many people in person as possible. And 3, anecdotally, though I don't have young children myself, I know my friends who have young children have reported to me that the mask for their young children isn't a bother for them, that they're able to do it and that they haven't voiced any concerns. So this is recommended, this is safe, this is effective. We have seen outbreaks over the summer in camps among young children. We have seen outbreaks throughout the school year among daycare centers among young children. So we know that COVID transmission does occur among those young children. We also know that masks are protected for people of all ages, and so that's why we're recommending them. Thanks. We don't want to get into the situation like they have in the South, where their children's hospitals are full, including their ICUs, and they're transferring kids out of state. We want to keep everybody healthy here.
Next question. Yes. Kevin?
Kevin Jolly, Fox Buffalo. Masks seem to be the biggest one of contention when you talk about kids returning to school. What do you say to the parents who just simply are not going to require their children to wear masks?
The question was, what do I say to parents who are not going to require their children to go to mass? They're not going to be allowed in school. They'll have to homeschool their children. They have an option, but they have to wear a mask in school. It's to protect not only their child, but the other children who are in that school, teachers and the like. So I want to go out and note that the vast majority of parents are supportive of this. We know this. There is a very vocal, small minority. But the vast majority of parents understand they want their students, they want their children in school 5 days a week in a learning experience. And so those parents who refuse to have their children masked in school, they're just not going to be allowed into school. They have to wear a mask or they will not be allowed into school, and if they so choose, they can homeschool their children. They have that option. Sandra.
I was interested to know, last year there was some criticism about saying the state was being too heavy-handed and that the county was also being heavy-handed and not communicating well enough with school leaders about with these, the guidance. I'm interested to know a little bit about how you involve school personnel in developing this guidance. And I'm also interested to know if schools, and I don't know if anyone here can address this, intend to offer virtual learning for parents who don't want their children to be masked.
The question was, what involvement do we have with the school districts and so forth in coming up with the guidance? We heard from the representatives. Mike and I talked a lot about what they were hoping to see, what they expected to see, what was asked. I mean, truthfully, we had district representatives say, please implement a mask order, because we don't know if we can enforce it on our own, but we know you can. And there needs to be equality across the county, where one district is not, another district is, and they happen to be in the same town. They're just multiple districts in one community. So we listened to them. A good example of that is there was an initial discussion as to whether or not we were going to require quarantining from anyone who was in 6 feet, any child within 6 feet. We heard from them that the CDC standard was 3. We did confirm that New York State no longer had the 6-foot standard once the emergency order was ended by New York State, and we decided, yes, it makes sense to follow the CDC standard as the school districts believed was appropriate to, on the quarantining within 3 feet rather than 6 feet of a child to a child. So we listened to them. I mean, I don't know if any of them want to offer any comment, and Dr. Burstein, but this was not just, here's the rule, you got to follow it. This was a cooperative effort, but the one thing I will note is, and not just the individuals in this room, but I heard from other school superintendents that they really wanted us to implement a mask order in conjunction with other things to protect their students, faculty, and staff, because they didn't know if they actually had the power to do it on their own. And it made sense to have a unified guidance and requirements for all the districts in Erie County rather than have a helter-skelter system in which some districts did everything and other districts did nothing. So, anybody? Okay, go ahead. Dr. Burstein has a portion too.
Thank you. Thanks. As I want to reinforce what the county executive said, that we work very closely with the schools. So with our methods, in addition to looking at the science and the already published evidence-based recommendations from CDC and AAP, we did involve the schools. So we did have a focus group of a small representative of schools that represented all parts of the county. North, south, east, west, urban, suburban, rural, and then we followed up by reaching out to all schools and all school districts and asked them to send us by email their thoughts and concerns, and we took all that into account when developing our guidance, because remember, the devil's in the details, and so we needed some help with that. Thanks.
Whoever. Once again, Lynn Fusco from the Erie District 1 BOCES, and the question was by Sandra Tan from the Buffalo News.
Thank you. Thank you for the question. The conversations that we've been having, you think might be just in the past 2 weeks. It's been since this COVID experience has come on for all of us. So we've been working intimately with the school team, with Gail, throughout this time as we've been working to maintain safety in our schools. So while you think the relationship and the development of guidance just happened over the past few weeks, it's really been a conversation that's been occurring throughout the whole COVID period.
Eileen first, and we'll get to you eventually.
Eileen Buckley, 7 Eyewitness News. How are you going to deal with the possible litigation lawsuits, the unmasked groups? They continue to want to fight this. They think it's, taking away their rights. They're not looking at it that a child that is unable to be vaccinated yet because of their age is being protected by these other students wearing masks. How do you hammer that home and get through these possible lawsuits?
The question was, how do we deal with potential lawsuits associated from mask groups and the like, or anti-mask groups? I would just note, no one has the right to send and put, I should say, no one has the right to get another parent's child and put them at risk. We're doing this for the greater good. Someone may not like this, I understand that. They have the right to litigate, they can sue us. You'll waste your money if you do that. We know from lots of legal precedent that we have the right and the power to do this. The Erie County Department of Health does through commissioner orders, and I do through emergency orders, because the state of emergency has not ended in Erie County. So if someone wants to sue, they'll sue. It's exactly like what happened with a lot of the suits that happened last time. They sued. They spent a lot of money on their attorneys. They may have won at one judge on the local level, but then it was appealed and they lost. We have a whole set of attorneys that work for the Erie County Department of Law who are set to respond to any suits we have. We don't spend any additional money on these lawsuits. They're going to spend thousands of dollars from an attorney who says we'll sue, even though that attorney, and I'm an attorney myself, knows that legal precedent is on our side. We have the right. Think about it. You can't send your kid to school without a shirt. You can't send your kid to school without pants on. Why? For very reasons, to protect that child in many different ways. But you can't send your kid to school and put other children at risk. If they're sick, what happens? They get sent home. They don't stay in the classroom, regardless of whether it's COVID-19, the flu, or the crud that it seems like a lot of kids get every year. So I would say to the parents, if you so choose, you want to litigate this, you can. We have a team of attorneys that works every day for Erie County who's standing by and ready to respond if need be, and we will win that lawsuit because the law is on our side. And if you do not want to send your child to a school where they're required to mask, you have the option to homeschool. Let me go with David first, and then I'll come to George.
Yeah, I'd like to hear a bit from Mike Cornell too about the involvement of the school in developing
Sure.
this action plan. I mean, how involved were you really? And what's the difference, if you were, between now and last year, when at times you were critical of the lack of involvement of schools in decisions being made?
So I'll take the second part first. I'd say, I felt quite involved, and it was a broad-based group of us, not just the three of us. And the conversation bounced back and forth from a larger group to the smaller group. And the acknowledgement of taking the public health imperatives of the Erie County Department of Health and then trying to balance them against the operational realities of what it looks like to run a school with real teachers and real kids every day. Those things are sometimes difficult to blend together, and what you're seeing in this document, it really is exactly that, a blending together of the public health imperatives along with what it means to implement them within the operational realities of running a school. So we never had that type of conversation with the New York State Department of Health. The field didn't really have any input into that guidance when that was issued this time last year. And we're grateful for the fact that, this time around we had direct contact. Mark and I talked on the phone pretty often. And again, some individual interaction, some broad-based interaction. And the other thing to keep in mind is when you do something like this, it doesn't represent the absence of disagreement. It's the result of what happens when you push through those things. You end up in a spot where everybody can say, okay, this is the right thing to do for our kids. And again, it represents the all-in thinking around getting our kids in school for 180 days this year, every kid. Nothing is more important than that.
And if I may follow up, questions come up of, okay, even this is called guidance, but I heard Dr. Burstein say mandate more than guidance. What fate awaits a school district that is not fully compliant, maybe not implementing the policies that they should? We know last year, the health department would go in and fine restaurants, or there would be some punitive measures. You're going to close the districts down. What happens if the district isn't going by the letter of all these laws here?
The question is, what happens if the district isn't going by the letter of all the laws? This is a guidance that does include requirements. Our goal is to work with our districts to ensure that they follow our guidance as well as all requirements. I'm not going to go into detail of what will happen thereafter if there is a recalcitrant district. Based on the conversations I've had with district leaders, I think they want to open up ASAP to full in-school learning, and they are expecting that if we work together and follow these guidance and rules, there will be no issues. The Department of Health, as well as Erie County, has substantial powers, and our goal is to ensure that students are there every day, as Mike noted, for the 180-day school year. And if the guidance and the requirements are followed, that's exactly what will happen. And we will have a safe learning environment for students. George, next.
I guess my question is for Mike again. Is it a big relief for school superintendents that there are no distancing mandates, that you have the freedom to decide your own distancing, but that, so although the way I heard it, there's no distancing mandates, but you're going to pay the piper if everybody's crammed in a room, and then it comes time for contact tracing?
The question was, what is it beneficial to the schools? There's no distancing mandates. There are requirements with regards to quarantining and so forth, depending on how far the student is away from the other student, 3 or 6 feet, whether they're vaccinated or not. Unvaccinated, they get additional protection, so to speak, from having to quarantine, and it's in the guidance. But this is an example where we heard from the school districts that not every school room is the same. Every classroom is not the same size. They have different students per classroom, and so we needed to give the schools an opportunity to figure out what's best for their teachers and their particular classrooms, rather than have one set rule that said, here's what it is, you got to follow it regardless of whether you got 42 kids in a class or 12 kids in a class. So with that, I'll turn over to Mike and David and Lynn if they have any additional questions or comments on this.
We kind of look at it in a sense of you want clarity and you want flexibility. So what we have is clarity around exactly what the expectations are, and it's something that we agreed to. To the comment or the question from Dave about recalcitrant school districts, we've agreed that this is the path forward. So we have clarity around the path forward, and we have flexibility in terms of how we operationalize certain aspects of it, like physical distancing and the like. And that's important when you're, as we ride the rest of this out, clarity around expectations and flexibility on some of the things that really matter in terms of providing great learning for kids every day. The way you might operationalize that in a kindergarten classroom may look different than it looks like in a senior level economics class. So we've got clarity where we need it, we've got flexibility where it's important.
Sure. To just extend on Mike's point, I would say that most of my conversations with school leaders, in the vast majority of situations, they're going to be able to attain 3-foot distancing for students throughout most of the day. There are those moments where there might be certain kinds of situations where students have to sit closer than that, transportation and the like. So there is the necessary balance of flexibility and clarity. I think that's a good way of defining it. And I guess, and further to that, I think going forward, there's a recognition that there are trade-offs on this. The mask requirement was necessary to be able to get all kids into those distances. So those pieces go together, and we embrace it as the best possible solution to try to get to the #1 goal of bringing all students back 5 days a week.
Yeah, if I could just add a little bit on that. Everyone likes to focus on the one aspect of this, masking, but the guidance is a comprehensive guidance taking into account all of these issues. That if you do not have and give the schools the flexibility they need for each of the classrooms and the settings, we would not be at a situation today where they're actually standing and sitting with us talking about why this is a document that allows them the guidance they need to move forward, as well as the flexibility to ensure a safe environment for all in a learning environment that changes from every classroom to classroom. Yes?
Brianne Coker with Spectrum News. This time last year, there were a lot of shortages. Is the county equipped to provide PPE and disinfectants to schools?
The question was, is the county equipped to provide PPE and disinfectants to schools? Yes, we have plenty of PPE. We have plenty of disinfectant. But one of the things that's part of this that we touched on, but I think has not been discussed enough, is the testing that the county is offering to do random testing to ensure the safety of the facilities. And I'll turn over to Dr. Burstein to talk a little bit about that. But one thing we didn't do last year that we're offering this year is actual COVID-19 testing, sampling that we recommend of a certain group of individuals on a rotating basis per school. And we're hoping that most schools take advantage of it so that we can actually do this analysis to determine is COVID-19 in the schools that we're not aware of because someone's maybe bringing it in asymptomatically. So Dr. Burstein?
Sure.
I'll let her answer that.
Thank you. So the Erie County Health Department is working with Quadrant Biosciences to offer our schools PCR testing with hopefully 1 to 2 day turnaround time for all schools that are interested. So there's we can offer testing of we call screening testing. So that would be a random sample. The CDC recommends 10% of the school community, so that would include students and staff who are unvaccinated to get tested by a polymerase chain reaction test for COVID-19 every week. We're also going to be offering asymptomatic screening testing, what we call for proximate contacts. So those are not close contacts. However, those are individuals who were, say, in the same room, in the same classroom, who as a COVID-19 case. So they weren't within the 3 feet or the 6 feet or whatever the definition was, depending on the person who was a case. However, for those individuals who are unvaccinated, who were proximate contacts, and even those who are vaccinated, whose parents or they themselves are interested to get testing, we will also be able to test them, even though they're not close contacts. So testing is one of our really strong strategies that we have in place. We're using polymerase chain reaction, which is the gold standard for COVID-19 testing. It has the best performance, the highest sensitivity, the lowest specificity. So we want to make sure that this is done with a good test, and we know the antigen tests are not as good as a PCR test, which is what schools were kind of forced to use last year. So again, we really want to work with the schools. And then, of course, anybody who is symptomatic, we're going to recommend that they go to their provider or go to our Erie County Health Department or one of the other testing sites in the community, not come into school, but rather, go into the community to get a diagnostic test. Thanks.
Before we take a second round of questions, are there any members of the media who are here who have not asked a question I would like? Tom from WBFO.
Is there anything in the guidance when it comes to when school districts should still offer remote learning, not only for when a parent doesn't want their child to wear a mask, but also just compromised students, disabled students? I'm not sure if that's a guidance issue or if that's still just up to the individual school.
The question is there anything in the guidance as to when school districts should offer remote learning? And this is an example of the flexibility. We're not saying here's when you offer remote learning, because remote learning for the city of Buffalo would not be the same as the Springville Griffith Institute. We need to leave the school educators, the leaders, make the determination on when remote learning is appropriate. If we had to mandate remote learning for Erie County, we'd be in a really bad situation with regards to new COVID cases and hospitalizations. We hope we never get to that point again. But when it comes to remote learning, we understand that there may be a time in which it's appropriate, but we really think it's best for the school district to make that determination in consultation with our Department of Health to guarantee that this is the right thing. Because remember, you'd be doing remote learning to protect the health of the individuals in the school, but you would create chaos, once again, for the parents who most of them are back to work, might not have daycare. Last year, we set up the virtual learning centers. Those are not set up at this point. So we really need the schools to make the determination in consultation with us when it's best, if it happens at all, for remote learning. Second round, we'll go back. Sandra.
You had said that these are mandates that might be adjusted depending on how things change. Do you actually have any benchmarks for when, a mask might no longer be necessary for everyone in the school? Also, I guess if perhaps Dr. Burstein could expound a little bit more on youth sports. Under what circumstances would school sports, team sports need to be suspended if in fact there were positive cases found?
The question was in regards to benchmarks of change for the guidance. First off, we are also subject to the New York State Department of Health, which could theoretically issue its own guidance. We don't have any particular benchmarks in place saying if we reach this, then it changes. But the CDC guidance is very important. If the CDC came back and said, okay, that you don't need to wear masks if you're in an area of low transmission, we would take that into consideration and change the guidance accordingly if that's what the change came from the CDC. However, the CDC has standard is mask wearing in all settings, regardless of whether it's high, substantial, moderate, or low. So that is something we would take into account. As I said, we expect it to change over time based on the situation in our community and potentially whatever rules are implemented by New York State. I believe Governor Cuomo has made his decision, and his tenure ends as of 11:59 p.m. tonight. Governor Hochul's tenure, I believe, begins at midnight tonight. I think I got that timing right. And she may come back with additional requirements that we hadn't even thought of, or we thought of and we didn't include. So if New York State comes in and says, here's what need to be done, we certainly alter it based on New York State. And then with regards to sports, this, I believe, unlike before where a team had to go on pause if there was one positive case, now it's 2 cases. So we do give the team an opportunity to continue even if it's only 1 case. If there's 2 cases, then the whole team's got to go on pause. And there are rules associated with vaccinated versus unvaccinated. Basically, if you're vaccinated, you're going to have a much better chance of staying active on the field and in practices than if you're unvaccinated because of the quarantine rules and the like. It is specifically in the guidance. I think it might be best to read the guidance and then if you have any questions to go in a little further detail rather than go through the whole thing right now. Because unless Doc, you want to do it? Yeah, she's got the guidance out. Let's do it. We'll get to you then, John.
Thank you. So what we're really trying to do is prevent transmission within a sports team that could, end up being transmitted throughout the school. So if there is evidence of transmission within the team, that's basically when we would, quarantine, people on the team. However, if there is one COVID-19 case on a team that is present while that person is infectious, all the unvaccinated players and coaches and staffs are required to pause for 10 days from the last day of exposure. So the vaccinated players and coaches and staff can continue to gameplay and team activities, and everybody can continue, whether they're paused or not, can continue to go to in-school classes unless they're unvaccinated and they're identified as close contacts.
Or the COVID-19 positive.
Right. Yes, or if they're COVID-19 positive, of course, they can't come to school at all. So again, pause is not excluding people from the classroom. It's just putting a pause on any activities affiliated with the team sport. So that would be a game, a practice, or any type of team activity. Again, that's for the unvaccinated. And then if there are players and coaches who are identified as close contacts, that are not vaccinated, of course, they would have to be in quarantine. However, if there are 2 or more players or coaches or staff who test positive during a 10-day period, which is the incubation period, all team activities must pause for 10 days from the last date of exposure from the first confirmed COVID-19 case. So all unvaccinated players, coaches, and staff are required to quarantine for 10 days from the last day of exposure to a COVID-19 case, and the vaccinated players and coaches and staff can still go to work and school. So this is, again, in our guidance that you can read for yourself. It's a little bit complicated, I understand, to digest. So I encourage everybody in the media and teachers and families to read the document. It's a good document. Thanks.
John, and then Dave, and then we'll be done.
Just a quick one, as far as teams go, when it comes to playoffs and state championships, is there communications with the other districts outside of Erie, the other counties, or?
The rules apply for anyone who comes to Erie County. So if there's a state championship scheduled, these are the rules that are gonna apply regardless of whether the team's coming from Rochester or Westchester. I remember one of the first things I had to do when I was county executive was basically order the cancellation of the New York State hockey championships. It was also the same time we were discussing and recommending the cancellation of the St. Patrick's Day parades. And I remember people were furious. And by a week later, it seemed like the least thing that mattered on the face of the earth was whether or not we were gonna hold the St. Patrick's Day parade or the state hockey championships, because by then COVID just exploded statewide. So it would apply to any team that comes into our region, into Erie County. So they would have to confirm if a state's coming in with a championship that they're COVID-free. If they've had multiple COVID cases on the team, these rules apply. It doesn't really matter what's happening in Westchester, because as we know, when you're playing sports, it's a tough environment to prevent the spread of COVID when you have people hitting each other, crashing into each other, wrestling with each other, depending on the sport. So it's not easy.
But I mean, cross notification.
Well, this will be shared across New York State. David, you get the last question. He bowed to me.
But it is for Dr. Burstein.
Okay, that's fine.
Which explains the bell.
Actually, that's better.
Go, Doc. Dr. Burstein, in item number 4, returning to school following illness, it says a negative at-home COVID-19 test will not, underline in capitals, be accepted to return a student to school or staff to work. I was going to ask you why. The closest you got to an answer in your statement was for obvious reasons. Forgive me. What's the obvious reason?
We don't have a magnificent grasp for the obvious. So the question is, why is the Erie County Health Department mandating that schools do not accept home-based COVID-19 tests? Several reasons. One is those are basically rapid antigen tests, and again, antigen tests don't perform as well as PCR tests. And 2, to do a test is very complicated, even though it may be approved to do at home. You have to make sure that people follow instructions like exactly, and that there are right environmental conditions like temperature and other conditions that have to be followed. And then also, people can forge results. So that's the reality. So we want a test that has been conducted under the supervision of a licensed provider of some level to make sure that even if it's a CLIA wave test that is done on site in the office, we understand that in order to receive that CLIA waiver, that office or that laboratory has to demonstrate that they have certain conditions in place and that they are a licensed provider to do this test. And we want to make sure that we are as accurate as possible about allowing people in that are healthy and excluding people in who are sick with COVID-19.
The PCR home test, I can get at CVS, no good.
Nope.
Okay.
That was the best. We saved the best for last. So thank you. And and again, I also recommend that if people are anxious to learn about their COVID-19 status, if they have symptoms or if they're a close contact. I understand it's very attractive to go to a drugstore and buy your own test and do it in the privacy of your own home, but it's more complicated than, say, a pregnancy test or other tests that are available to do in the home. And also with a pregnancy test, right, you do eventually go to a healthcare provider to get that confirmed. So we strongly recommend, since in Erie County we have such great COVID-19 test availability, both rapid tests and PCR tests, that you go to a licensed laboratory to get that test done, whether it be in a pharmacy or a pop-up testing site or your healthcare provider or the Erie County Health Department. Thanks.
Thank you, Dr. B. I would also note, the Erie County Department of Health does free COVID-19 testing. Call 858-2929 for an appointment. Why pay money for a test to find out if you're positive, and if it comes back positive, then you gotta get another test anyway, when we do the tests ourselves and we do them for free. So with that, I wanna thank our guests that were here today. Superintendents Mike Cornell, David O'Rourke, Lynn Fusco, as well as Dr. Dennis Quo, who had to leave. And I do appreciate their support of our guidance that we've issued. I wanna thank you who've stayed on and continued to watch us after our intermission. And hopefully we never have one of those again, but I believe this is probably the longest press conference from beginning to end, no matter whether it was COVID or snowstorms we've ever had. I want to thank the members of the media for hanging in there. This is a very important topic, and it all gets back to two goals as we talked about. Returning students to an in-class learning experience for 5 days a week for the entire school year, and doing it in a safe manner to protect all, the students, the faculty, the staff, the other administrators that are involved in the day-to-day educating of our most precious resource, our youth. So thank you to all who played a role in making this a reality. We know not everyone is going to be pleased. That's what you have in a society, is you don't have uniform agreement on anything. But I do want to thank the parents out there who contacted us and said, please get my student back into school 5 days a week. It's okay if they wear a mask. It's okay if they have to do other things. The most important thing for my child is to ensure that they're back in an in-learning experience for the whole school year. I want to thank those parents, because you're often not heard from, you're often not interviewed, but you are the vast majority of the parents in our community, from the city of Buffalo to the school district in Akron to Springville Griffith and everywhere in between. Your voice has been heard, and please understand that the number one thing that we are trying to do is protect your child, other children, and the faculty and staff, and ensure that your child gets the best education possible from an in-school learning experience. So thank you to all those parents out there. And of course, thank you to Dr. Burstein and her school team. We actually have a school team of epidemiologists who did not get their epidemiology degree from Facebook. They got it from the University of Buffalo School of Public Health. Some of them masters, even doctorates. I want to thank our school team, who's worked a lot to come up with this guidance in a very short period of time. We thought we might have to do something, but when New York State abdicated its responsibility, they stepped up to the plate and worked hard to get it done. So thank you to our epidemiology team, our school team in the Erie County Department of Health, for your tremendous effort to get a very important guidance and requirements done in a short period of time so our school leaders can get kids back into school safely.